Hello everyone, welcome to my YouTube channel N-Gurukul. Today we will see about the Chaetophobia. A phobia is more than a simple fear. It develops when a person begins to organize their life around avoiding things they are afraid of, whether it's animal, places and etc. Likewise, Chaetophobia is one specific type of phobia. Here the person is having fear of human or animal hair. Chaetophobia is a fear of hairs. The sufferer's fear may be associated with human hair or animal hair. They may also fear the hairs on their own body. The term chaetophobia comes from the Greek word cat, meaning the loose flowing hair, and phobia meaning the fear. Here are some causes. The chaetophobia, like all other phobias, has no known cause. In this phobia, one experiences extreme anxiety when exposed to hair. This type of phobia can be a result of a number of factors such as genetic and environmental. This genetic factor refers to the genes and neurotransmitters of the body. Some with a family history of the phobia and or a mental disorder have a higher chance of having the same or different disorder in the future. According to this, the genetic predisposition will not develop symptoms of chaetophobia until and unless there are some triggers events. An environmental triggers event will be a someone developing chaetophobia because in their childhood they had been physically or sexually abused by someone who had loose hair. Some symptoms of chaetophobia. The symptoms of chaetophobia are very similar to other specific phobias and it include feeling of panic, dread or terror, inability to relax, an impending sense of dread, problems concentrating, being quick-tempered, feeling of dizziness, palpitations, poor quality of sleep, sweating excessively, breathlessness, migraine and headache. So, in the treatment, the chaetophobia is treated by a number of different therapies. So, the first therapy is cognitive behavior therapy. The therapist helps the patient in replacing the irrational thoughts with more rational ones. The patients are helped out in analyzing and justifying the way they feel about getting exposed to hair. Therapists assist them in uncovering the reasons behind the fear. Later, they provide them with alternate pleasant thoughts. They are used ABCD method. First, A indicates for the antecedent is a situation or triggering event. B for the belief. The thought comes to one's mind when a triggering situation. C is a consequences. It's the symptoms of feeling caused by the event or thought. D is a dispute. It's the alternate or irrational thoughts provided by the therapist. D is the dispute, alternate or rational thoughts provided by the therapist. Second one is the exposure therapy. It is one of the most frequently used way of treating patients with chaetophobia. In this therapy, patient is exposed to the source of his fear over a certain span of time. Third is a mindfulness based stress reduction therapy, that's the MBSR. So, the MBSR is a meditation therapy used to manage stress or anxiety. Lecture and group discussion are also done to talk about mental health and increase interactivity. In this meditation, patient told to focus on the sensation felt while breathing. This distracts the person's attention from something stressful to something which is neutral and soothing. Fourth one is a cognitive behavior therapy. That's the CBT. It is more commonly used for the personality disorder, but it also used to treat the phobias. Coping skills are taught in CBT group, which lasts for about 6 months. Last one is a drug therapy. There are two types of drugs are used in the treatment of chaetophobia, and they are: first is the anti-anxiety drugs, for example clinopin, that's a clonazepam. These drugs help to reduce the anxiety. It alternating electrical activity between the cells of the brain. Initial dose is 0.25 mg BID, means that 2 times a day, and it may increase to 1 mg after 3 days. Second is the antidepressant drug. For example, Pixel is a paroxetine hydrochloride. It also helps to balance a serotonin by preventing brain cells from quickly absorbing it. Initial dose is 10 mg. It may increase up to the 60 mg. So the chaetophobia is a new condition. Everyone having a knowledge of what is chaetophobia, its causes, treatment and therapist of chaetophobia. It will help the nurses easily handling of the patient and to improve the quality of mental health.
Make sure to subscribe my channel. Thank you. Have a great day.